With the upcoming flu season, many people have questions regarding the differences and the similarities between flu and COVID. And really the only way to tell the difference if you do become sick is by testing. When we look at the symptoms of them, they are very similar. Both influenza and COVID can cause fevers, they can cause chills, they can cause myalgias, headaches, sore throat, even vomiting and diarrhea. One of the symptoms that's more unique to COVID, however, is the loss of sense of taste or smell. We don't see this in influenza, but we've been seeing it frequently in COVID infection. One of the things that's different as well is the symptom onset. So with influenza, your symptoms tend to come on more quickly, so over the course of a couple hours or a day. Whereas with COVID, it tends to come on more gradually. So over the course of a couple days, you start to get worse as your symptoms progress. With both COVID and influenza, you can be sick for on an average of about 5 to 7 days. In terms of the ability to transmit the illness, though, COVID can be transmitted much longer. So you can actually transmit COVID from about 2 days prior to symptom onset to about 10 days after you develop symptoms. With influenza, you usually can transmit it about 1 day prior to symptom onset to an average of 5 to 7 days after. With COVID infection, we've been seeing a lot more patients who are having a prolonged course of illness. This can be anywhere for even up to a couple of months of symptoms. Some patients have had prolonged fatigue, even prolonged fevers, prolonged issues with their heart, going on months after illness. Most people who have serious illness are the same for both COVID and influenza. So these are older individuals, people with underlying health issues such as obesity, diabetes, high blood pressure, lung disease, people who are immunosuppressed, and also pregnant women. So to protect yourself from both flu and COVID, the most important things to do are things we've been doing. So wear a mask, social distance, and wash your hands. This will protect you from both influenza and COVID infection. In terms of influenza, the most important thing you can do is get your flu vaccine. The flu vaccine has been shown to decrease your risk of getting influenza, to decrease your risk of having a bad outcome from influenza, and to decrease your risk of death from influenza. So if you experience symptoms of either influenza or COVID, you should be seen. Call your primary care physician if it's not an emergency. So if you're not feeling short of breath, having chest pain, or anything emergent, for those you would go to the emergency department, of course. But if you're otherwise okay, you should call your primary care doctor to be seen, and they can do testing for you.